temperature, and then capillary refill all look great. Just going to do the same thing to the other side. Nails look good. Skin looks good. I'm going to go ahead and feel your head for any depressions, abnormalities, lesions, anything like that. Do you have any concerning things on your head?
No.
Okay. So just let me know if you feel any discomfort. Anything?
Mm-mm.
Okay. I'm going to go ahead and palpate your sinuses. So let me know if you feel any discomfort here.
No.
No. Okay. Now I'm going to check your lymph nodes. Do you have any issues with your lymph nodes? Do you have any pain, swelling, anything like that?
No.
Okay, let me know during this assessment if you feel anything like that, okay? Preauricular, posterior auricular, occipital, thyroid, submandibular, submental, superficial cervical, deep cervical, posterior cervical, supraclavicular. Anything hurt?
Mm-mm.
No. Okay, I'm going to go ahead and listen for a bruit. Do not know any bruit. All right, now I'm going to check your thyroid. So I'm going to come around here, have you tilt your head to the right. Okay, I'm just going to push right here, and I want you to swallow. Okay, now I'm going to do the same with the other. Okay, good. All right, so now I'm going to go ahead and take a look at your nose. Okay, do you have any issues breathing, anything like that?
No.
So I'm going to look for deviated septum. Does that hurt at all?
Mm-mm.
Okay, I'm going to have you cover one nose and try to breathe. Now do the same with the other one. Any issues there?
No.
Okay, I'm going to take a peek inside your nose. Okay. Looks good. No drainage, no exudate, no discoloration. Now I'm going to check your eyes individually. Make sure they're equal, round, reactive to light. Okay, so I'm going to cover up this eye. Just look straight at me. Okay, good. Okay, good. Pearl is intact for both eyes. Okay, I'm going to take this red. This is just testing your peripheral. So I'm going to have you look right at me and let me know when you see the red, okay?
Okay. I see it.
Okay.
I see it.
Okay. Now I'm going to take my finger and I'm going to go directly at you, and I just want you to follow my finger, okay? Okay, good. All right, now I'm going to do a static wiggle test. So what I'm going to do is I'm going to kind of come in closer like this. I want you to cover one at a time, and I want you to let me know when you see my fingers wiggling, okay?
Okay. I see them. I see them.
Okay. All right, good. Now the other eye.
I see them. I see them.
Okay, good. All right, so now I'm going to have you look straight at me, but follow my fingers, okay?
Okay.
All right, so. Okay, good. All right, so now I'm just going to take a peek in your eyes. So I just want you to look at me directly. I'm going to look for your red reflex first. So I'm going to have you cover the one eye, and I'm going to go look in this eye, look for the red reflex, and I'm going to go in and hold it a little bit further, look at your eyes and the structures inside, okay? Good. Red reflex is intact, looks good. You can do the same with this eye. Looks good as well. All right. Looks great. Your eyes look awesome. So now I'm just going to check your eyelids, make sure the coloration's good, anything like that, okay? Okay, good. All right, now I'm going to move on to your mouth, okay? So what I'm going to have you do, the first thing I want you to do is repeat like, tight, dynamite.
Like, tight, dynamite.
Okay, good. Now I'm going to have you stick out your tongue against your cheek on both sides. Okay. Now I'm going to have you stick out your tongue out like this. Okay. Can you smile for me? Can you frown for me? Can you lift up your eyelids? Can you puff out your cheeks? Okay, good. Do you have any pain in your tonsils? Do you have tonsils?
Yes.
You have your tonsils in. Okay. Do you have any teeth ache? Anything like that? No. Okay, so now I'm going to take a look inside your mouth. So I want you to go ahead. Okay, I want you to go ahead and stick your tongue out. All right, looks good. I'm just going to look down your teeth. Okay, looks good. Okay. All right, good. Now I'm going to start looking at your ears, okay? So I'm going to use, let's see, I'm going to do the rhyme test first. So I'm going to use this. I'm going to hit it on my arm, put it right behind your ear, and I want you to let me know when you stop hearing the noise. Then I'm going to put it next to your ear, and I want you to let me know if you hear it then, okay? So we're going to have you cover one ear and do it with the other ear, and then we're going to switch, okay?
Stop. I can hear it.
Okay, now we're going to do the same thing.
Stop. I can hear it.
Okay, now I'm going to take this, and I'm going to do it on top of your head, and I want you to let me know if you hear it equally on both sides, okay?
Okay. Yes.
Okay, now I'm going to do the whisper test. So what I'm going to have you do, I'm going to go behind you and I'm going to whisper a couple words in your ears, and I want you to repeat them back to me, okay?
Okay. 3T4 L2T.
Okay, good. All right, now I'm going to take a look actually inside your ears. All right, good. Left ear, the cone is a light is at the 7 o'clock. And I'll look at my right. Cone of light is at the 5 o'clock in your right ear. Okay, good. All right. Let's see. Now I'm going to check your thyroid. So I'm just going to put my finger here, and I want you, or your TMJ, sorry. I'm going to put my finger here, and I want you to open your jaw and just look for any clicks, pops, anything like that. Does that hurt when you do that?
Mm-mm.
Okay, good. All right.
Your wrist. Can you do this for me? Great. That's as far as you can go. Great job. All right, can you do that for me? Awesome. Thank you. And then can you put your hand flat on the table for me? Great. And then what I need you to do is try and move your pinky out to the side a little bit like this with your whole hand. Thanks. Great. And then back to the middle, and then same on the other side. Perfect. Thank you. Thanks. All right. Can you put your hands like this for me? Perfect. This one as much as you can do it. Can I have you put your hands like this? Okay. Great. Can I have you place your hand on the table like this? Great. So because he can place his hand flat on the table, that means that his MCP, PIP, and DIP joints of the 5th through the 2nd digit are all fully extended, so we don't have to measure for that. Now can I have you lay your hand flat on the table? Great. So I'm going to put this here, and I need you to try and bring the tip of your finger down to the base of this as far as you can go. Perfect. Now we're going to do our 4th digit. Great. And do this one, your 3rd. Perfect. And your 2nd. Great. And bend both these joints as much as you can. Perfect. You can relax. And then can I have you extend out as far as you can go? Great. Perfect. Great. You can relax. Can I have you lay your hand flat on the table? Great. So what I'm going to have you do is bring your thumb out as far as you can go to the side. Ready, go. Perfect. And then can I have you put your hand up like this? Great. I'm going to have you do the same thing. Bring your thumb out that direction as far as you can go. Ready, go. If you could bring your hand up and to the side like that. Okay. Hold it there. Don't let me move you. Perfect. You can relax. That's a 5. And then try and bring it the other direction with your thumb that way. Great. Hold it there. Don't let me move you. Perfect. You can relax. Both are 5s. Okay. So now for the extensors. Can I have you bring your pinky up and over this way? Great. Hold it there. Don't let me move you. Perfect. And then bring it more towards your thumb side and lean forward. Great. Hold it there. Don't let me move you. Perfect. That's a 5. And then lean normally and same up to towards your thumb side. Hold it there, don't let me move you. Great. Can you bring your hand in towards this direction? Great. Hold it there, don't let me move you. Perfect. And then, can you lean forward and bring your hand out as far as you can go? Hold it there, don't let me move you. Great. And then go back to normal, and then bring your arm out as far as you can go. Great. Hold it there, don't let me move you. Can I have you bring this part of your finger up so you're flexing it here? Great. Hold it there, don't let me move you. Perfect. Now do it with this finger. Hold it there, don't let me move you. Great. Bring it up. Hold it there, don't let me move you. And the last one. Hold it there, don't let me move you. Great. All right, can I have you bring this finger up? Hold it there, don't let me move you. Great. Now this one. Hold it there, don't let me move you. This one. Hold it there, don't let me move you. And this one. Hold it there, don't let me move you. All were 5s. Can I have you bring your hand like this? With your hand, with your palm on the table. Thank you. Hold it there, don't let me move you. Hold it there, don't let me move you. Hold it there, don't let me move you. And hold it there, don't let me move you. Perfect. That was 5. Can you bring your hand like this for me? Okay. Hold it there, don't let me move you. Hold it there, don't let me move you. Hold it there, don't let me move you. And hold it there, don't let me move you. Perfect. Hold it there, don't let me move you. Hold it there, don't let me move you. Great, go through 5s. Can you spread your fingers apart? Great. So spread this one as far that way as you can. Hold it there, don't let me move you. Great. Now move that one that direction. Hold it there, don't let me move you. Move it this way. This one this way. Hold it there, don't let me move you. Great. And then this one that way. Hold it there, don't let me move you. Perfect. Can I have you hold your hand up in the air like this? Great. Hold it there, don't let me move you. Perfect. Hold it there, don't let me move you. And the last one, hold it there, don't let me move you. Great, great. All 5s. Hold it there, don't let me move you. Great. Hold it there, don't let me move you. Perfect. Now can you extend it? Okay. Hold it there, don't let me move you. And hold it there, don't let me move you. Perfect. All over 5s. Can I have you bring your thumb in as close as you can? Hold it there, don't let me move you. Perfect. Now can I have your hand flat on the table and bring your thumb out as far as you can? Hold it there, don't let me move you. Great. And now can you do this? Great. Hold it there, don't let me move you. Perfect.
We're going to start by assessing visual field, and when we assess visual field, we're going to assess one eye at a time because the visual field can be different in each eye. And we're going to start by having our patient cover the eye that's opposite ours as if we're looking in a mirror. So I would say, Mike, can you please cover your right eye and keep your head up nice and straight. And when Mike covers his right eye, I'm going to cover my left eye. And I'm also going to tell the patient to look directly at my nose. So I'm going to say, Mike, please look directly at my nose. Do not take your eye off of my nose while we're doing this test. Now what I'm going to do is hold up my hand in the periphery of your visual field and slowly bring my hand in. As soon as you can see my hand, let me know if you see it. And I'm also going to be holding up a certain number of fingers. When you can tell how many fingers I'm holding up, let me know when you see that as well. Do you understand what I'm asking you to do?
Yes.
Okay, please look directly at my nose. Here we go. Let me know as soon as you can see my hand.
I can see it.
Okay. Let me know when you can see how many fingers.
2 fingers.
Very good. And you can take your hand down. So we would repeat that same exercise with the eye covered from the nasal visual field, the inferior visual field, and the superior visual field. And we would do that for each eye. Okay. Now what we're going to do is look at pursuits. So when we're looking at pursuits, we're looking at a person's ability to visually fixate on a target and move their eyes in sync with the target with nice smooth movements, not jerky movements. We also want to look and see if they're able to keep their head still while they're following the target, or if they need to move their head side to side. We also want to see, we're testing in standing because we want to see if the person can maintain their balance while they're doing pursuits, or if they start to sway their body, which could be a sign of vestibular dysfunction. We're going to start with the target about 16 inches away from the patient. And what I'm going to say is, Mike, can you see the end of this pen here, the blue end to the pen?
Yeah.
Okay. Now you can use a target symbol like this, or if you have a stick with a letter, you can use that too. And let me know, Mike, when you look at the end of this pen, do you see one end or 2 ends? Okay. So you want to make sure that they're fixating with both eyes and not having double vision. And then I'm going to say, Mike, I'd like you to follow the end of this pen back and forth and around in circles while I move it. Do you understand?
Yeah.
Try to keep your eye on the end of the pen. Here we go. Okay, so notice when Mike starts to track, he's moving his head. So I'm going to say, so I want to observe that. I don't want to tell him ahead of time not to do that because I want to see if he does do that naturally. That tells us that he's having a little bit of difficulty disassociating between his eye and his head movements. Now I'll cue him and say, okay, Mike, I'd like you to look at the end of the pen and please try to keep your head still. And we're going to see now that when prompted, he can keep his head still. If he couldn't keep his head still, what I might do is ask him to put his finger on his chin. Can you put your finger on your chin? And that can then help cue the person to keep their head still. Okay, and then as I move the pen, I'm going to go in an H motion, crossing the midline of the H in front of his eyes, and then going up and down. I'm also going to go in circular motions, staying within their visual field. Now I intentionally have the pen between myself and the patient, so I know if I can see it, then they can see it. Okay. Nice job, Mike. Nice, good, smooth movements. I'm going to take the pen away. If Mike's body had started to sway during that, like I said, or he was not able to move his eyes without keeping his head still, then I would suspect that there is a ocular motor difficulty or a vestibular difficulty. And also, if this person could not do what I'm asking them to do in standing, I would have them do it in sitting. Thank you. So now we're going to look at the person's ability to perform saccades. So saccades are jumping motions from one target to another target. Again, you want to hold the target about 16 inches away from the patient's face, and you want the targets to be within their field of vision. Notice we started with the visual field assessment first, so we know where the field of vision is. So we're going to hold up 2 targets. The 2 targets could be letter targets. Today we're just going to use pens. And again, you could do this in sitting or standing. This time we're going to assess in sitting. but you can also do this in standing to assess for body movement, head movement, sway, or loss of balance. So we're gonna hold up our 2 targets, and I'm just gonna say, Mike, what I'd like you to do is shift your eyes from looking at this target to this target until I say stop. And we're gonna have him repeat this about 10 times. And as we're gonna start in this horizontal plane, and then we will do a vertical plane, a diagonal plane, and then the other diagonal plane. So we're gonna start in the horizontal plane, horizontal motions. And so here we go, Mike. I would like you to look back and forth from the pink to the blue target. And what we're observing for is to see if Mike needs to turn his head to do this, if he's able to hit the targets with his eyes, or if his eyes are over or undershooting the target, which are all signs of oculomotor dysfunction. And he is looking very good. All right, nice job, Mike. So now we're gonna go into our vertical saccades. So looking up and looking down from the blue tip to the pink tip. Or again, if we were using letters, we would maybe have an M on one and a T on the other. And again, I'm looking for his ability to hit the target. And I also want to ask Mike, as you're going back and forth between the 2 targets, are either of the targets double or blurry?
No.
Okay. And I'm observing nice smooth movements and good ability to hit the target. Thank you. Now we're going to do diagonal motions. So we're going to take one and put it up to your right, one pen, and the other one down to your left, and I want you to go back and forth between the 2 targets. Good. Is each target 1?
Yeah.
Are any of them blurry or double?
No.
Okay, nice work. And we're going to go the other way. Here we go, up and down on the diagonal. Up to the left, down to the right. Okay. You can also, to test for movement sensitivity, if they're doing very well hitting the stationary targets, you can start to move the targets and see if they're able to still hit the targets and if it makes them feel dizzy. Mike, does this make you feel dizzy at all?
No.
Are the targets still singular?
Yes.
Okay. Nice work. We're going to stop there. Thank you. So now we're going to be looking at convergence. In particular, we're looking at what's called the near point of convergence. The near point of convergence is how close a patient can fixate on an object and keep their eyes together on the object without one eye breaking away from the object or having double vision. So for some patients, you might have to start near point of convergence testing pretty far out, depending on how well they can control their eyes. Others, you may be able to start closer. We're going to start about 2 feet away from the patient today, and I'm going to say, Mike, and excuse me, you can use a pen tip for this exercise. If the pen tip is not big enough for the person to see, you could use a pen cap or a letter marked on a tongue depressor or a dot on the tongue depressor for a larger target. But for this, we're going to use our pen tip, and I'm going to say, Mike, can you see the tip of this pen?
Yes.
Okay, I'm going to bring the tip of this pen closer to you. Right now, when you look at the tip of the pen, is it one tip or is it double?
Just one.
Just one. So I'm going to give a little wiggle and make sure both eyes are fixating on the tip of that pen, and it's one. And now I'm going to start to bring the tip of the pen towards you. Follow the pen tip in with your eyes and let me know if it splits and becomes double. All right, here we go. And we're going to watch and make sure the eyes are coming in together. And right there it's split. We may have noticed that the eyes stop coming in together at that point, and we measured that at about 5 inches. So we're going to repeat it a couple times and see if his eyes get better, worse, or the same. So here we go, Mike. I'd like you to follow this in. You still have one pen tip there?
Yeah.
Okay, we're going to bring it in. Let me know if it splits or becomes double.
There.
Okay, and we're going to measure it again. Okay, that time we've got 6 inches, so that's a sign that he may be fatiguing a little bit. We're going to bring in one more time, really try to bring those eyes in, and look at the pen tip.
There.
Okay, and there we are at about 5.5 inches. So if we took the average of that, we would say your near point of convergence is at 5.5 inches. Thank you, Mike.